Hello, my name is Raj Jain, MD. I'm a hematologist oncologist by training, and I'm sorry I could not be there to join you in person. Monique asked me to describe my role in the prevention of MRSA infection initiative at the VA healthcare system and also talk about how PD contributed to the results that we were able to achieve over the last few years. So let me just say a little bit how we got into the MRSA initiative. In 2002, we became aware that there is an issue with MRSA infections, although it wasn't really a big issue, but we wanted to do better than where we were. And we initiated the program on 2 units, initially in an ICU and in a surgery unit. And then later on, as we were able to see some very good results of about 60 to 70% reduction in the infection rate, we then decided to expand the program to other units. That's where we were introduced in 2005 to the positive deviation approach by Jerry Sternan, and we successfully used that in the VA Pittsburgh healthcare system to expand the program to now include the entire system of 13 different units, and we're able to show the same type of results that we obtained on 2 units. It was about that time that we made a decision, working with the VA central office that has about 150 hospitals across the system, and we decided to expand the program to all of the facilities in the healthcare system. This is where my experience in working with positive deviation and expanding the program within VA Pittsburgh, we felt that this was the approach to follow, and we were very successful in introducing that approach to all 152 hospitals. Now, in terms of how PD contributes to the success of the results, let me first quickly show you a graph, what I'm talking about. The top graph describes the ICU infection rates, and the bottom graph describes the infection rates in the rest of the units. And I know it's hard for you to see, but this shows about an 80% reduction in infection rates in the ICUs and in the non-ICU units in our healthcare system. Now, how did PD contribute to it, and then what's my role? So I believe that PD contributed in many ways. First of all, it created an integrated team culture. We were able to get more team members from broader disciplines than we were able to do before, because after all, the prevention of infections is about hand hygiene and about gowning and gloving. As more and more staff become engaged, they understand their role, they understand how it contributes to infections, they're able to follow through on compliance of gowning and gloving and making sure they follow through on hand hygiene. And that's where PD was very, very helpful, because there is a deeper understanding of their role in prevention of infection. I also think that by having the policies and the procedures developed by the disciplines themselves contributed to the compliance of those policies and procedures by nurses, physicians, by housekeepers, and others. In terms of my own role, I was mostly engaged in making sure that we had the budget and the resources for gowns, gloves, and the MRSA prevention coordinators at all of the facilities. I was also engaged in making sure that the national policy and the procedures were developed in a timely manner, the training activities that were involved in training all of the staff, and how that would play a role in making sure that everyone understands the approach. And again, using the PD-based approaches of engaging the staff allowed us to make sure that the message was communicated to all of the facilities. In the end, let me just summarize by saying that when I saw the excitement in the staff using the PD approaches at VA Pittsburgh, I became convinced that this is the approach we need to use for national expansion. Thank you.